A majority of Wisconsinites, including those with insurance, report going without health care due to high costs. Local 5's Samantha Petters has the details and shares the stories of those impacted.
You do everything you can to help, and sometimes it's just not enough.
HSHS Sacred Heart officially closed its doors in March of this year, with St. Joseph's Hospital in Chippewa Falls following shortly after, due to financial challenges with the loss of business to larger hospital chains. Jennifer Olson says it was one of the most difficult times watching her community suffer.
I've watched overdose rates go up. I've watched issues with ladies, having their birth plans ready, and then all of a sudden the rug's ripped out from under them. Not only did the community suffer by losing health care, but all the members of the community that were staffing those hospitals also now are trying to find employment too.
Seeing the impact hospital closures had on Olson, James Harris worries the same will happen in Green Bay, especially with the treatment the HSHS healthcare system was able to provide his son as he battled leukemia.
It's pretty scary actually, because it's the kind of problem that'll go almost completely unnoticed except for the actual people it impacts. Because say St. Vincent's closed tomorrow, we still would have gotten my son treated. We would have just lost everything constantly commuting to Milwaukee.
As a student at UW Green Bay and a father, he says he hopes preventative measures will be taken by new legislation.
Closing systems that treat uncommon diseases, it makes sense from a financial perspective, but from a people perspective, it's the worst possible thing you can do. And that's kind of why we need legislation regulating this.
While State Representative Kristina Shelton tells me she is not running for re-election, she plans to continue being an advocate for healthcare reform and the working class.
There's certainly great bills that are out there. We'll see some of those reintroduced in the 2025-2027 legislative cycle. Certainly you'll see the governor take a look at some of this in his budget as we look towards that budget cycle. But again, I'm hopeful as we look towards more fair maps in November to try to remove some of that gridlock and get more work done.
In Green Bay, Samantha Petters, Local 5 News.
Here in Green Bay, a spokesperson with Prevea told Samantha, quote, HSHS plans to invest significantly in our Green Bay ministries, and in partnership with Prevea Health, we are committed to continuing to serve our communities in this important region.